Good afternoon and namaste. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. Apollo Hospitals has always been at the forefront in creating health awareness, and with our Facebook Live sessions, we hope to create the right amount of awareness and give you authentic and factual information. This month, we have dedicated our sessions to women's health, where we have been discussing not only gynecological and reproductive health issues, but also health and well being in general, because knowledge and self awareness is the first step to helping us be the best version of ourselves and also support our loved ones with informed health choices and decisions. Even if you think you know everything about your children, when they get older and become teens, you may need to know them all over again, without assumptions, judgment, or superficiality. They say there are three basic things you need to connect with a teenager: an open mind, a sense of equality, and a supportive attitude. It becomes all the more important when you have to talk to them about their health issues. For daughters and sons, talking about sex, reproduction, and relationships is an important conversation. But for girls, it's also important to emphasize on their body changes and menstruation. This is easier said than done for many parents, but these conversations can be had with empathy, trust, patience, and persistence. So, come, let's understand this subject from Dr. Preeti Prabhakar Shetty, consultant, obstetrics and gynecology. Dr. Preeti Prabhakar Shetty is a senior consultant in obstetrics and gynecology at Apollo Hospitals, Bangalore, with over 15 years of experience. She is a specialist in high risk obstetrics, gynecological surgeries, and infertility, with experience expanding more than a decade. She's also received special training in procedures like hysteroscopy, colposcopy, and laparoscopy. Her special interest lies in teaching and training DNB candidates, and she has also published several papers in her specialty. Particularly, her paper on injectable depot medroxyprogesterone acetate, a safe and effective contraception for the Indian setting, was published in Health and Population Perspectives and Issues Journal, ICMR. Welcome, Dr. Shetty, to this discussion. Thank you so much for joining us. And this is, in a sense, a session which I think everybody will be very keen to understand. How to talk to your teenager about reproductive health matters is something which everybody is interested in and keen on, and we really look forward to your valuable insights.
Thank you. It's my pleasure.
So maybe we should start by discussing which is the age to, and I think let me clarify that for the purpose of this discussion, we will, since it's related to women's health, we're going to talk mostly about the daughters, about the girl child. So what is a good age to start talking to a girl child on matters of reproductive health?
See, a girl child, it should be prior to her entering her teens. In fact, children, I think from the time they are born at different stages, we have to make them aware of certain things, like when they start talking, when they name their body parts. The genitalia should be named either, the penis should be called the penis, the vulva should be called the vulva, just like you name your hands, the legs, the eyes. There should not be any shame in naming the genitalia, external genitalia. So that it starts from right then.
Yes.
As a child grows and you think the child is, asking questions, there should be books and pictures to introduce the child to different aspects of the human body, including the reproductive system. Now, 9 to 12 is usually the time that a lot of teens, they start getting their secondary sexual characteristics. So they see the body changes that come in. So some children might get it even earlier. So depending on your child, you have to introduce that topic a little earlier in terms of what is sexual health and what are the aspects, what is normally going to happen in the body as she goes through those periods, and emphasize on the fact that it is something which is normal. It is not. It should not be talked with any kind of shame or any kind of guilt, so that the child also is open to the topic. The child will not feel that there is something wrong that is happening to me or my body. So the time to start would be much earlier, much before the onset of teens.
So, what would be the key things to talk about to the preteen?
Yeah. How you go about talking with the teen would be, you have to be, number one, very honest and direct, and the sex education starts in school at around 8th standard or 7th standard. So the idea would be to supplement it, reinforce it, and supplement it, because sex education is as much a responsibility of a parent, and it should be done with no kind of shame. So you have to seize the moment when you're maybe watching television or watching some video about some sexual health, and talk about it. Invite the discussion from the child. It should not be like the child should feel weird about it or funny about it. So, and you have to go beyond the basic information. It should not be just about, okay, this is the reproductive system, these are the different parts. Those are facts. Definitely they need to know facts, the scientific facts about what happens in sexual intercourse. Those are the facts, but you have to move beyond the facts too. You have to let them know about the feelings, the emotions, the attitudes, the values, the ethics, and this has to be done in the context of maybe the personal views, religious views. All this will kind of help in setting up a stage where the child can look forward to a healthy sexuality in future.
So, don't you think, doctor, that a similar conversation, apart from the male puberty, do you think boys also should be given?
Definitely.
I think both boys and girls should be kind of
Definitely.
given a
Yeah,
holistic view
yeah,
of
yeah,
the
yeah.
whole thing instead of keeping the
Yeah,
two
it's not
completely separate.
segregation, definitely, because see, they learn both things. In
Yes,
school, it is, sex education, they learn about the male parts and the female parts. It's
yes.
not like I'm telling you, okay, this has to be segregated.
No,
Of
no.
course, maybe the girl, depending on when you're expecting her to have menarche, it should not come as a shock to her. That's what I'm trying to tell. Everything, you have to preempt it and start it much, a little earlier, maybe.
Sure.
And sex education in school starts around 7th standard, 8th standard, but we do see puberty hitting girls earlier now.
Yeah, yes.
So, yeah.
So, why do you think that is, in the sense, like, why do you think people are getting, I mean, girls are attaining menarche much earlier than before?
Yeah, see, the timing of puberty, it depends on several factors. It is not just, it's about genetics, it's about environmental factors, then the whether it is close to the equator, the geographical location, the socioeconomic status, the weight of the child, if the child is overweight or underweight. So timing of the puberty depends upon those factors. So, like delayed puberty is because of like early puberty is because of something like if the person is overweight or genetically there is some issue. So, similarly, delayed puberty is because of there'll be constitutional delay or it will be like 30 to 40% of them will be physiological, no problems found. But some of them would be due to certain chronic diseases or chronic illnesses. There can be some kind of like too much of exercise can cause delay in the periods. Okay, and chronic illnesses like even endocrine disorders like thyroid disorders or illnesses of if there is some renal disorder or the child is having some tumor, some brain tumor or something like that, that can cause delay in the period. So each aspect has to be clearly studied, evaluated, and depending on the diagnosis, treated. So timing, again, it is an interplay of a lot of factors. So just like early puberty is because of genetics or constitutional or weight issues, late puberty also would be due to the opposite at the other end of the spectrum. Yeah.
So, what would be the earliest and progressive signs of puberty? What would be the signs of puberty?
Signs of puberty in a girl I would be talking about. So they go through some stages. It's called Tanner staging. So first stage, there are no obvious signs. That is at the age of 8. Second stage would be somewhere between 9 to 11, where you see early breast buds and where there might be some kind of itchiness or some tenderness, some pubic hair. So that would be in stage 2. That would be 9 to 11. At around age 12, that would be stage 3, the breasts will increase in size, the pubic hair becomes thicker, the axillary hair develops, there can be a growth spurt, like height spurt of 3 inches per year almost. They can develop acne, there's body fat deposition in areas around the hips or on the thighs. So then further staging at around stage 4, at age 13 approximately, you have menarche or onset of menses. And by 15 to 16 years, that is stage 5, most of the reproductive organs are quite well developed. Yeah, so that happens in those stages. Yeah.
So when you say it is a premature early menarche these days, is it like before the age of 8, or what is
that
the?
would be precaution. That is up, very early. What we
Okay.
see is early, maybe compared to their mothers, the previous generation, a year earlier is what we are seeing. Again, exposure to so much of environmental exposure,
Yes.
how their mind works, all that will affect on how early their systems mature. But earlier, like at age 8 and earlier, is considered precocious puberty. So that is not considered complete. That is not considered a norm. Okay, it's not
Yeah.
considered normal or physiological. That would be a little extreme of this, and it needs to be evaluated to see if there's any condition, there's any problem associated with it, and treated. Underlying condition treated. Moreover, if the child is not attaining, has not attained the growth, and the endocrinologist has to be brought into the picture, and hormones might have to be supplemented so that it can get suppressed for some time. Again, emotionally it can be quite challenging. So the child, the family, they might need to go through some kind of a counseling to handle this. The child has to understand that this is not something that she has brought on herself. Okay, and healthy lifestyle definitely will help, meaning diet, exercise, so that the weight issues don't come into the picture. But again, such children, they should not have issues because of body image, like
Yes.
psychological issues because of body image. So they will require counseling with a child psychologist. Yeah.
So, what will your advice be to a family who's, either the child is, having early
So they
precocious
have to seek help.
or it is delayed? So, how should the family approach the child? I mean, what kind of support should they provide?
If it is early, they need to seek help. They need to see if there's any medical disorder associated. The child might need, certain hormonal medications as per in coordination with the endocrinologist. Will need a psychologist to counsel the child and the family, and the family has to also make the child feel comfortable
Yeah.
with her body, with the changes that she is going through, and there has to be some kind of an openness in communication
Yes.
so that the child doesn't
Child,
fit in.
yeah, in school and her peers also, she might be having some
Yeah.
difficulty at
So
school as well.
there has to be communication about why it's happening, what is happening. So that's why a professional counselor will help. On the other hand, delayed puberty, I think like I touched upon earlier, delayed puberty, the cause has to be figured out. If it is 30 to 40% of them would be physiological, so then nothing really to worry. There will be some people with certain causes, like I said, chronic illnesses. So those illnesses have to be treated depending on the cause of the thing. Suppose it is cancer related, it has to be treated. If it is related to the medications of cancer, that has to be managed. Similarly, if it is related to some kind of chromosomal disorder, then it has to be diagnosed and accordingly managed. Yeah.
Absolutely. So now we'll talk a little bit about hygiene. hygiene aspects of menstrual hygiene and reproductive health hygiene. So, what should a child be taught about hygiene in
See,
this
personal
regard?
hygiene is very important for children, for teenagers. They have to be number one, comfortable with their parts of the body. They should be comfortable enough to wash it on their own, and plain water. They should wash it regularly with plain water, not to use harsh chemicals, soap, shampoos, or even the advertised feminine washes is not really necessary. Plain water is more than enough. Even if they are using the washes, it has to be pH balanced. And the direction of cleaning should be from front to back. That is important. And frequent change of the sanitary pads during the menstrual period, cycles, not to douche and not to wear very tight undergarments, or if they are getting wet, or to change into dry undergarments after an exercise, because those are the causes for infections that we see, the vulvovaginitis or urinary infections, not taking enough water. So all those things, yeah.
Earlier, there used to be this. Most people were using cloths, and then came the pads. But now there is again a resurgence. I mean, you see a lot of debate about using cloths and reusing them and
Yeah,
eco-friendly and all that. So,
yeah.
what would your view about this be? And if they're using cloths, then reusing them, what kind of precautions are needed?
Basically, it has to be washed well. That is the most important thing,
Oh,
because blood is something which can attract a lot of bacteria and infection. So if they're using cloth and they don't have an access to this, it has to be washed well. And I think after a certain number of uses, it has to be discarded. You cannot keep reusing it.
I think it
So
makes sense.
washing it with soap and water well, and drying it outside so that it's sun dried, that to a certain extent might prevent, because otherwise the blood is something which can attract a lot of germs and bacteria. It's like a media for growth for germs and bacteria. Yeah.
And I guess it needs to be stored also in a clean place after being before the
Yeah,
next use, not
definitely have to be stored with the rest of your clothes, because it's just as I mean, it's not like that part of your body is something completely different. Just like you keep your rest of the clothes, I think you can keep the panties and the I don't think there should be any shame attached to your sanitary pads or the clothes that you use during that menstrual period. Yeah.
Absolutely. So we did touch upon briefly about exercise and diet to be followed in the adolescent phase. So are there any particular tips and or even related to supplements and things like that? So what kind of dietary changes should be made, or it should just be a healthy balanced diet?
No, it's basically a healthy, balanced diet. But what we see in children in this age group, adolescents, is there's a lot of some condition called polycystic ovarian disorder that we see, and that is related a lot of times to their weight gain. And so we do advise less fat, less carbohydrates in their diet, and more of proteins, and a good amount of exercise, at least about 40 minutes of physical activity in a day, because children, especially now in the last 2 years, I think they've been so prone to just sitting in front of their television screen or the iPad screen and online classes, and not really going out and exercising. So 40 minutes of physical activity per day, and definitely a diet which is less in carbohydrates, less in sugars, fats, and more of proteins will help. Also, no junk food, because all these are the factors which kind of promote polycystic ovarian disorder. Most of the time, if with lifestyle modification, these aspects, the problems of PCOD and obesity do come down. But and of course, as they mature, we do see the regularizing of their periods as it happens. But lifestyle modification is a must, and the younger they start, they can be, they are able to maintain it for a longer period of time. Yeah.
Sure. So after this conversation on attaining menarche and the menstrual cycle, then comes a stage where, the teenager will be growing up and there is a possibility of relationships and sexual activity. So there, what do you think? Is it important to advise them about safe sex and about contraception? And how is that nowadays done? Do the parents have to do it, or is it through some school related programs?
I think in the Indian scenario, still, I'm not very sure if parents really want to talk about
Yeah.
contraception to their,
No.
growing children, even if they are getting into adulthood. So the best thing would be to get them at least to a gynecologist who can talk to them regarding the various contraceptives which are available. Because, using a contraceptive following safe sexual practices would be the best to avoid unwanted pregnancies, STDs, STIs. That is so important for.
But it is a difficult conversation, I think, for most parents in our context to have.
Yes, yes,
I think this advice is great that if they can all come for a kind of a
yeah.
some checkup
Counseling.
kind of thing
Usually, we do have
where
counseling. Earlier it used to be always before girls would get married, they would get them for a counseling session. So I think they have to start in a little earlier.
yeah, probably yes. Another question which a lot of children have in their mind, but again, an uncomfortable topic to discuss with, especially the parents and all, is the masturbation. So there are a lot of myths and misconceptions about it. And so, would you like to say something about it as to what is to be kept in mind about it? I mean,
I think what generally comes up is masturbation bad? It is not. It is completely natural. It is a normal thing for a teenager to engage in masturbation. In fact, it will help in their physical and mental health because number one, if there's no possibility of an unwanted pregnancy. Number two, no possibility of a sexually transmitted infection. So I think they should not feel guilty about it and not feel ashamed about it. It's something which is normal and natural for a teenager to engage in, both girls and boys.
and related to the marriage itself, of course, now many people are in their 20s, at least early 20s. But is there some kind of an ideal age to get married? Though, of course, it's not something that you have to do at a particular age. But from a gynecological point of view and a psychological point of view, what do you think?
No, I think now that the legal age is being raised to 21, it's wonderful.
Yeah.
We will not have any teenage brides or teenage pregnancies at 18, 19 too. So they have to be physically and psychologically mature enough, not only about having a baby, to make the decision for themselves regarding their reproductive health, regarding their family planning, regarding contraception. The girl should be able to make that decision. I think the after 21 would be, definitely better. 18, 19. I'm not sure. Just because the reproductive system is well developed, whether she should have a baby at that stage. Yeah.
Is also the adolescent period a time when there are a lot of emotional and psychological disturbances that happen? And what would your advice be to parents, to or families? What are the I mean, is there some situation where, apart from the usual, I mean, teenagers are dismissed as, being cranky and, difficult. But when is it that, you have to really counsel them or take them for professional help, or at least sense that there is something that is amiss?
Teenagers, like you said, when you have a teenager at home, there'll be some that irritability and crankiness. They're prone to anger and tantrums, and you face it on and off. But if persistently you see there's a lot of anger coming in, violent outbursts, or the child is having extremely volatile eating habits, either eating too much or eating too less, socially withdrawn, not really interested in a lot of things, keeping to herself or himself. I think those are some early signs that you can think that your child might need some help. because mental disorders, they around 50% of them, they manifest by the age of 14, and 75% of them are they manifest by the age of 24. So if you think that the child, child is showing some extreme signs of these, it is always better to take to a professional, because you have about, during adolescence, you have about five types of disorders. I wouldn't be the best person to comment on that, but broadly it is said to be like anxiety disorders, stress disorders, disorders of the behavior, the mood, of the attention deficit. So you have five different types, and it is due to different causes. It's not necessary it's only because of stress. Of course, a lot of pressure at school they face. There will be some children will be facing some problems at home due to some conflicts, or they might be having some body image issues because of self consciousness. But it's not just environmental issues. Sometimes there can be an underlying biological cause. There can be some genetic causes for that. As gynecologists, what we get into the picture is, because these mental, when we screen them for these mental disorders, we refer them to a psychiatrist. And when they are put on medications for their mental disorders, these medications can sometimes affect the hormonal levels. It's called an HPO axis. And that can cause irregularity in their periods. It can cause galactorrhea, some kind of not getting periods. So that is what we come across in our practice. Also, another thing is, sometimes these disorders, they can be given to drug abuse. So they can like resort to drug abuse. So when they have this risky behavior, they can go for a sexually risky behavior too, resulting in unwanted pregnancies and teenage pregnancies. So that is when, as gynecologists, we come into the picture. So these are the things that basically in terms of mental disorders. Yeah.
Yes. You were talking about self-consciousness. So in terms of their physical appearance, because that is the time when they look a bit awkward. And another concern is how their skin looks, how their hair looks, and all the comparisons with their peers. So do you think, is acne a part of this whole thing, or is there some way to kind of keep it or is it that some people don't have any skin disorders at the time of puberty?
No, at the time of puberty, because of the hormonal surge, you will have, because of the hormones increasing, androgens specifically, there will be the oil secreting glands will secrete a lot of oil. So that results in that, along with the accumulation of dead skin and bacteria, can cause an outbreak of acne. Also, like I told you, some of the young girls we do see something called polycystic ovarian disorder, which has an imbalance of hormones, more of androgens, and that can cause an outbreak of acne. So when there is an underlying gynec cause like PCOD, we can put them on some pills to which regularizes the periods and does get the androgen levels down, and the acne comes down, the hirsutism comes down. So there are pills for that. But if it is purely, skin related, then a dermatologist will be brought into the picture in terms of the topical ointments and topical cleansing and, whatever this. But it is, of course, it is a natural progression. So yes, some people will have more, some people will have less. That again is an interplay of genetics, environment, weight, obesity, all those, there'll be that interplay of those factors also. Yeah.
Absolutely. So I think we've had a very elaborate discussion on all aspects related to growing up and the teenage years. So thank you so much, Dr. Shetty, for joining us here today. And viewers, I do hope that you enjoyed the session. So do reach out to us for any further queries, and we're present on all social media channels, as you know, to respond to any assistance or support that you need. So I do hope that you have gained valuable insights from this session. And for most parents, for most mothers, In the teenage years, it is a little difficult to walk that fine line between being a friend, listening to the child, and also being some kind of authority figure for the child. It is a tightrope walk, but do make it a priority and make communication and talking with your daughter or your son an integral part of your life together. So, wish you all the very best and thank you, and see you again very soon. Namaste.